Hi, everyone. Welcome to RapidRads. I am Dr. Gary Cook.
And I'm Dr. Chris Riley. We're really excited to have you here.
All right, so let's get into our topic of the day, which is going to be radiology, the basics.
Today, we're going to focus on 4 different topics in the basics of radiology. And we're going to start with terminology, then we're going to go to densities, then we're going to go to techniques behind radiographic imaging, and lastly, orientation of the patient for each radiographic image. So first up, terminology, we have attenuation. And what attenuation is basically how dense a tissue is. The more dense a tissue is, the more radiation it absorbs. Therefore, it is a higher attenuated structure, such as bone. We have a bone here highlighted with high attenuation or high density. And then we have soft tissue, which is going to be low attenuation because it's absorbing less radiation.
And just so you guys are aware, bone absorbs more radiation, and thus less radiation gets to the backboard. And because less radiation gets to the backboard, it is more white. When tissues are less dense, more radiation goes through them and gets to the backboard and thus looks black. And the areas of air that are surrounding this knee are completely black. So next, we're going to talk about density, which is similar to attenuation. There are 4 densities to an X-ray or a CT scan, essentially. There's air, there is fat, soft tissue, and bone. And those get more dense as you go down that list. So air is the least dense of those 4. And then bone is the most dense or the highest attenuated.
So with density, you can describe something as hyperdense or hypodense. And that's the same thing with attenuation, hyperattenuated or hypoattenuation.
Exactly. Okay, so our next term is going to be the Hounsfield unit, otherwise known as HU. This is a unit for describing tissues on a CT scan. It's based off of their attenuation coefficient. So kind of, again, that attenuation is coming back here, and that's to describe how dense something is. So we'll start with air, which is going to be -1,000, and then fat is -30 to -70. Our CSF/water is going to be about 0. On this particular scan, this is an intraventricular hemorrhage. So you see that bright red blood. That's going to be +65 to +95 HU. And then lastly is our bone, which is considered about +1,000 HU.
So this next concept is phases, and this has to do with timing of contrast administration. So when contrast is given intravenously, the radiology techs using the computer system can time the contrast to highlight whatever the structure of interest is. And in the image on the left, we see a CTA of the chest looking at the aorta and a CTPA on the right image highlighting the pulmonary artery looking for PE. And all this is demonstrating is that really bright contrast is being fed to different systems at different timing. So the one on the left is being shot when the contrast is going through the aorta, and the one on the right is when the contrast is being pushed through the pulmonary artery.
Okay, so let's move on to orientation. When you are looking at a chest x-ray, the left side of your screen is going to be the right side of the patient, and the right side of your screen is going to be the left side of the patient.
And this is similar to just anatomical positioning, right? When you're looking at a picture of anatomy, it's always the patient facing you, and the patient's right side is on your left side, and their left side is on your right side.
Laterals might not always be the same orientation. You essentially use your context clues. You can see that the spine is on the left, so that is posterior. And then the other aspect of that must be anterior. So let's distinguish between AP and PA on a chest x-ray. An AP is anterior posterior, and a PA is posterior anterior. And essentially what that means is which way is the patient facing when they're getting the x-ray done. When they are facing the probe, we call that an AP. Now, because they are facing the probe, everything sits a little bit more anterior in the chest, and thus it's going to cast a larger shadow on the board. A PA is our posterior anterior. Now the patient faces away from the probe, and because of that, the heart and the structures within the chest are going to be closer to the board. And thus they're going to cause a smaller shadow, and that's going to be a sharper image.
Whenever we're getting chest x-rays, the ideal image would be a PA and lateral, which we'll get into in later videos. in the course. So next up is planes. We're talking about axial, we're talking about coronal, and we're talking about sagittal. So axial is, imagine you are looking at a patient lying down flat and you're looking at the bottom of their feet and you're taking your x-ray vision going from the bottom of their feet all the way to their head. So if you're thinking about that orientation here, you're going to see the right side of the patient on the left of your screen, the left side of the patient on the right of your screen, the anterior portion of the patient up top, and posterior on the bottom. Again, this is a cut right down the middle, like a magician sawing someone in half.
Mr. Magic Man.
Mr. Magic Man.
That's what they call Dr. Riley on shift.
Sometimes. So this is a coronal. Coronal means crown, which is coming straight down the patient. So think of this as you are looking straight at the patient and they are staring right back at you. And the patient's right here is on the left of your screen and the patient's left is on the right of your screen. And again, this is anatomical position. Up top is cephalad towards the head and down below is caudad towards the feet. And our last plane here is sagittal. So we have the anterior portion of the patient on the left of your screen and the posterior portion of the patient on the right of your screen with the vertebral column seen there. We have cephalad towards the head and caudad again towards the feet.
And when you guys are going through these, make sure you're using all of your planes because sometimes you can see images better in one plane than the other, and we will definitely get into that in more detail in future videos. The last thing that we want to talk about is the scout. The scout view is essentially the x-ray that is taken with all of your CT scans. It is quite helpful sometimes when you're trying to orient yourself and see where you're at on your CT. And this example that we're going to do for you is a CT brain. Now, the x-ray version of the skull is there with the yellow line, and the plane that we're using for this particular image is a sagittal view of that CT brain. Now, if you have a bleed or something like that, it can be sometimes difficult to appreciate where in the skull that might be. So you can put these two images next to each other. And as you scroll, you can see that that yellow line is going to approximate exactly where you are. So you can orient yourself to where that bleed is.
So in review of this basics of radiology video, we went through some terminology with attenuation, Hounsfield unit, and density. We went through different phases, arterial versus venous, orientation, AP versus PA with chest x-rays, planes, axial, sagittal, coronal, and using the scout can absolutely help you with figuring out where you're at in your CT scans. Guys, that's the basics of radiology. Thanks for stopping by. We'll see you in the next video.